I wanted to bring today's episode to the podcast talking all about libido. This is for male and female libido. We're talking about some of the reasons why your libido may be low and what are some strategies we can do right now, especially if you're dealing with painful sex or maybe you have erectile dysfunction. We're going to be talking all about how to look at this completely differently so you can improve your intimacy and have some great sex. So excited for you to listen to today's episode. Let's go. Hey, Dr. Deb, excited to have you back on the podcast.
Hey, it's great to be here.
Yeah, we were on the podcast back in 21, I think, and we were talking all about male factor fertility issues. So today we're going to be digging into libido, but just get us caught up to date. What's I guess as far as where are you right now with your practice and things like that? What's new? Just give us a little bit of an update.
Sure. So my practice is in Charlotte, North Carolina, Signature Wellness.
Yeah.
And we help both men and women get their hormones in balance. So hormones is like what we are known for, but we do full functional medicine assessments. So it's not just about focusing on the hormones themselves. It's all the factors that help knock the hormones out of whack if there in fact is a hormone problem. And so we really love helping people get well so they can get off their prescription medicines and love the way they feel and get pregnant if that's on their list of things that they're looking to do.
That's right. Awesome. Great. Well, excited for us to dig into today's topic. So many people come to us either they've been told potentially, they've got low AMH or high FSH, might be told they're in perimenopause. They could be experiencing symptoms of vaginal dryness, low libido, and worrying. Our whole thesis of this is it actually the adrenals? Is it actually early menopause or is it the adrenals? And so as we start to work on the biochemical side of things, the mental emotional, and these things, then the fertility can come back online. But let's talk about libido. And really for women, what are some symptoms you're seeing there? And then we're going to talk about, and for men as well, then we'll talk about kind of things we can do to improve our libido.
Sure. Well, I think libido is one of those things that we don't always sort of agree. What does that even mean? And for some women, what we mean by that is that the desire is not there. Like, we're busy. We got other things on our mind. We're tired. We just want to go to sleep. We could really kind of care less at the moment. So the desire is a problem. And that's the bigger problem that I see for women. But if they, get started and become intimate with their partner, they can become aroused and have an orgasm. It can be okay in the end. So it's not that things aren't working. It's just the turning on on the desire is not there. For other women, on the other hand, there's just nothing. Like, hard to become aroused, the vaginal lubrication, hard to have an orgasm, like the whole system is just kind of shut down. And there's often two different things going on. And so if we are, I think it's important to know which of the two we're talking about, in any particular person, because we're going to want to do something a little bit different. Does that answer the question?
Yeah, exactly. So we've got, so it's like, that vaginal dryness, painful intercourse too. We're like,
Well, of course, if it hurts, of course, you're not really going to be interested or become aroused or, it's not a pleasant experience. And that's so common. And it's just something that is not talked about, because where do you bring that up in conversation? Mostly your doctor is not going to know what to do with that information. I mean, they don't have a lot of tools that they can do to help. There are things that we can do to help, but like, your general family practice doctor or whatever doesn't have a lot of things that they can do. And sometimes these conversations actually make them feel uncomfortable. So you may feel uncomfortable bringing up the topic to your provider, but your provider sometimes doesn't feel comfortable because they don't really have a lot of fixes.
Right, exactly. Yeah, and they can also have, lack of sexual thoughts or fantasies. As you say, it's like just not even thinking about it. I've got a headache. That's not even on the radar.
Yeah, exactly.
And then for men, obviously this can present differently for men, right? With erectile dysfunction, but like, what are we seeing here for low libido in men?
Yeah, I think, again, it's the same idea, is that there can be a lack of desire. Like men, when they're young and virile, they have lots of thoughts about sex all the time. And then that just sort of can sometimes go away so that they're just not really thinking about it. They don't really care about it. Like, it just sort of doesn't really become much of a thing anymore. And if that's happening on both, to both partners, then there's not an awful lot of intimacy going on. On the other hand, men can have the desire there, but not the physical reaction. So either they're not able to get a very strong erection, or they're able to get an erection, but then they don't keep the erection. So, they lose the erection once they get started with intercourse. A lot of that can really have a big impact on how men feel about themselves. It really impacts their self-esteem, and that creates a lot of anxiety. And anxiety is something that is a real libido killer for both men and for women. So, when we get into talking about some of the whys behind why is this happening, sometimes the problems that people are having with sex cause more of the problems that people have with intimacy.
Yeah, the chicken or the egg. Keep chasing it around. Okay, so let's talk about for women. What are we seeing as some reasons here for low libido? What are you seeing?
Well, one of the reasons that's probably not so common in women who are trying to become pregnant, but is birth control pills. Birth control pills shut down hormones. They're replaced with the synthetic chemicals that are in the birth control pills that aren't real hormones. And so low testosterone and lack of testosterone function is a super common thing that results with birth control pills. In fact, we use birth control pills on purpose for that, because when young women have acne, they're often given birth control pills for their acne because it suppresses testosterone. So if you have terrible acne and you don't want to get pregnant, well, maybe okay. But if you're not aware that birth control pills do this, then you may have difficulties in your relationship. You may be missing out, without having any idea that it's birth control pills. Another important one is antidepressant medications. There's especially a class of medications called SSRIs, or serotonin reuptake inhibitors. So these are things like Prozac, Celexa. There's like a whole category. And those also are very well known to decrease libido. In fact, we use them on purpose for this purpose. So if we have men who have problems with premature ejaculation, sometimes we on purpose prescribe them these kinds of antidepressants because it lowers their libido, and sometimes that can allow them to last longer during sex. So antidepressants are another really common cause of low libido for women that most women have no idea. I mean, we hand out antidepressants all over the place, and it doesn't really come with a warning to say, like, listen, this may put out the fire. So I think that's important to know. And if you're on antidepressants, I'm not saying that you should just cold turkey go off them. I'm just saying maybe it's time to go back to your practitioner and ask about options if this is a problem for you.
Right, it can be a reason. Yeah, like with birth control, obviously, like post-birth control pill syndrome, you're coming off and you have all these different issues with your health and food sensitivities and gut infections. And obviously, talked many
birth control pills do a lot. Yeah.
Right. Yeah. And then I've done many episodes on anxiety, depression, and really looking at your neurotransmitters and, do we need sometimes we do new medication, but alongside the, looking at the functional side of things, from why are your neurotransmitters off to begin with? And yeah, I think some of the stuff's just been handed out like candy by doctors. And I think it's like the informed consent isn't there. And people don't realize that, oh my goodness, there's a reason I've been on birth control and that's what's caused my libido issues, or I'm on the SSRI, and you just think that you're, in this case, if you wouldn't be on birth control trying to conceive, but many times people have been on 10, 20 years and then they come off and now they have issues with that, and not necessarily thinking the SSRI is causing, some libido issues. So, yeah.
And then the depression or anxiety on their own can cause low libido. And so, we don't want you to be depressed either. Like if you have significant mood issues going on, we do really want to address those, because when your body is, in order to really become sexually aroused and be able to really enjoy the experience, you have to be relaxed, you have to be calm. And if your brain and your neurotransmitters are not doing the right things, then it's often hard to really relax and enjoy into it. And so anxiety and depression on their own, without antidepressant medications even in the picture, are causes of low libido. And another really important one, and that's true for men and for women, and another really important one is stress. When we're under chronic stress, our hypothalamic pituitary adrenal axis, our HPA axis, it gets triggered. And this is what regulates our ability to cope with stress. But in our body's infinite wisdom, our body can sense that if there's stress going on, it's not really the right time to procreate. And your body doesn't react differently, whether there's a famine or a war, or your mother-in-law is driving you crazy, or, your boss is a jerk. Like, your body reacts to stress the same way, no matter what the stress is. And there's a whole constellation of things that happen. But at the end of the day, one of the things that happens is that our sex drive is shut down, our sex hormones are kind of shut down. And it kind of makes sense evolutionarily why that might be, but it's not very helpful. So I'm sure you've talked 1,000 times about how important stress is to fertility, but that's a really, really important libido killer.
Mm-hmm. What about blood pressure too?
Yeah, and blood pressure that's too high and blood pressure medications
Right.
are both things that shut down, and especially beta blockers, which is a class of medication that sometimes is used for anxiety. It's sometimes used to prevent migraine headaches, in addition to being used for things like heart disease and high blood pressure. Very well known to be libido killers.
Yeah, and then chemotherapeutics, and then also antipsychotics, I guess, which we kind of talked. Yeah. And then what about, so that's for women, really for both. Anything else for men that we might have missed there?
Well, so some other things are smoking, because just smoke, does so many terrible things in our body, including interfere with blood flow. And in order to feel aroused, blood has to flow to the genitals. Alcohol, the thing about alcohol is it takes away our inhibitions. So sometimes it makes you more happy and playful, and like that might make it more likely that you kind of get into the mood. But if you go overboard with the alcohol, then kind of everything sort of gets numb, and then it kills the mood. So too much alcohol is not a good thing. And marijuana as well can impact your hormone levels, and a little bit might make you feel more relaxed, etc. But if you go too far with it, it's another libido killer.
Okay. And then, so let's talk about some of the reasons. So we got some of the medication and sort of that piece, but let's talk about some underlying reasons that really people aren't really thinking about with libido. And then a lot of these are clues as to how to get your reproductive health back in line too. So what are you seeing there? Some of the reasons.
So a really important thing, especially if the problem is desire, then often, stress is a big part of it, but often hormone issues are a problem. So for both men and women, testosterone is really important for our libido, and testosterone can go down for kind of all the same reasons we just said. So stress and too much alcohol, and as we get older, naturally, both men and women, our testosterone levels go down. There's birth control pills makes the testosterone go down, but testosterone is really important for thinking up the idea in the first place, for having the thoughts, for being able to become aroused. So it is important as one piece of the factors that play into desire. And it's not the only thing. So if somebody, has low desire, just going and getting a prescription for testosterone replacement therapy is not like a home run guaranteed, all in thing. However, being low in testosterone is one of the things that can lower libido. There is another hormone called DHEA, or dihydroepiandrosterone, which is why we call it DHEA, because it's too long to say. That's the precursor hormone for testosterone. And for women who are able to make enough DHEA, they can typically make enough testosterone, and that's beneficial under these circumstances. Sometimes, though, when we're stressed, our adrenal glands kind of start to shut down a bit, and we don't make enough DHEA, and therefore we don't make enough testosterone. So that's another factor that can play into the libido. And when we have a lot of inflammation in our body for whatever reason, whether we have insulin resistance, prediabetes, an autoimmune condition, toxins in the environment, a bad diet, like whatever the cause of the inflammation in our body, inflammation is going to affect so many different things. But one of the things that it does is it tends to make us more tired. It gives us more brain fog. I mean, it affects our brain in a lot of ways. It makes us feel more depressed, and it reduces libido.
Yeah. And then what about, there's a study here talking about thyroid too. This is something that we see across the board.
Humongous one. Absolutely.
Yeah.
So low libido is such a common symptom of low thyroid. And just while we're on the topic here, high cholesterol is a common symptom of low thyroid. But these are things that are not really taken into account. With low thyroid, we think of cold, constipated, hair falling out, gaining weight, like tired. Those are the common things that people think about. But low libido is like almost universal. It's just so common. And part of the reason is that when you don't have enough thyroid, you don't really have blood flowing the way that you need it to. That's why we're cold all the time. And that's why our muscles ache. We're not getting enough blood flow everywhere. We're not making enough ATP, which is the energy that our bodies need. And so libido just goes down. And restoring normal thyroid function can make such a big difference. And of course, thyroid is just absolutely critical for fertility too. But yeah, thank you for mentioning that, because that's a huge one that is missed so often.
Yeah, I got to hear a study that showed that 50% of women with an underactive thyroid also had low libido. Go figure. And
Yeah.
and
So
we
see it all the time.
right, and we see it as a theme too with people that are on the fertility journey out there. Oh, my TSH is normal. They've told me it's normal. Or hey, I went to see my REI and then they wanted the TSH under 2, so they gave me thyroid medication, and no one looked at the full panel or the antibodies or why the thyroid's out to begin with and why you're having painful sex and low libido, and let's just put a Band-Aid on and rush you off to the clinic. So
In fairness, that's what we're taught to do in medical school.
Right.
They're just doing what they were taught.
Right. And so that's why to have a team where you can have the OBGYN maybe in conventional medicine or REI, but you also want to have someone who thinks functional medicine, functional nutrition, all of that piece, be like, wait a minute, something's been missed. It's not to exclude, right, the conventional doc. Maybe you need to get medication. Okay. And then what are anything? Yeah. So I guess the adrenals or the cortisol piece. And you do want to go a little bit more about that for people, I think, with libido. I think we touched on it a little bit, but what you're seeing there with cortisol.
So cortisol has a circadian rhythm. It's supposed to be high in the morning and low at night. A lot of times it gets flipped around backwards. So it's low in the morning and high at night. Sometimes it's just high all the time. Sometimes it's just low all the time. Any of these patterns can get in the way of libido. And when we talk about it, it's stress of any kind. So it can be the stress of worrying about fertility. It can be the stress of having a hormone imbalance. It can be the stress of toxins. Like sometimes you have no idea that the stress is going on, but it's just one of the most common things that we see. And, telling somebody that they should reduce their stress is so unhelpful, right? Like, wouldn't we all love to just have reduced stress? But understanding what's going on with your, cortisol and your adrenal function can be really helpful in order for us to help predict what should you be doing in order to get things better.
Right. Sometimes we just need to see it in black and white. Kind of like we're like, oh, I feel kind of burnt out. I feel a little overwhelmed. Or like, well, here's the test telling you that, well, yeah, you are. You need to pull back.
Yeah. And just like before you were saying, like with the TSH, sometimes they want the TSH to be really optimal, not just quote unquote normal.
Right.
And I would say exactly the same thing should be done for your adrenal function, because if your cortisol is somewhere in the general normal range, but it's not following the normal pattern, it's not optimal, just as important as thyroid. And that's not something that, they're really looking at in the conventional medical practices, even in the fertility practices, even though they know perfectly well that stress is a really big deal when it comes to fertility, but we really want to optimize your adrenal function.
Okay, so let's talk about some strategies of things we can do to improve this then. What are we looking for? So I guess the desire piece is not there. We can talk about that. What?
Okay. So one of the first things that I would say is we do need to think about stress. And it's not so much about reducing stress. I mean, if there's ways that you can reduce your stress, that's awesome. But it's really more about how you allow the stress to affect you. Because for whatever stress you have, if you're a worrier, if spend a lot of time imagining the worst case scenario or reliving that conversation over and over again. I can't believe she said that to me. You're taking whatever stress you have and you're just magnifying it and making it worse. If you are able to be an optimist, if you can, look for the positive in things, let things go, you can have the same amount of stress and you can protect yourself from some of the damaging effects of that stress. So it's really important what you think about. And you might not have full control over the stresses in your life, but you do have some control over what you think about. So this is simple. Just think about positive things. It's not easy, right? And you have to catch yourself when you're, in the negative thinking. And some of the ways that can be really helpful to break yourself out of it is if you catch yourself kind of in a negative thought pattern, if you can say out loud, stop, or put your hand out, like stop, sometimes that's enough to break the thought pattern. So now you can think about something more positive. Another thing that I find is really helpful is to think about three things that you're grateful for. Especially, if you're sort of chronically having these issues, if you have a gratitude journal, this is mine right here. And every morning when you get up or every night before you go to bed, write down three things that you're grateful for. You can put it on a sign on your fridge so that you're constantly reminded. You can't feel stressed and anxious and angry and grateful at the same time. So that's really powerful medicine because your brain can't tell the difference between what you're imagining and what's really happening. So if you're thinking about all the negatives, your brain or your body is going to react as though that's actually happening, which is not what we want. So thinking the positive thoughts is such powerful medicine. But of course, there's walking, yoga, breathing, meditation. There's so many things that we can do to help counter the stress in our bodies. And it's so important. Nobody can do it for you. There's no pill for this. Nobody can give you a shot in your butt. Like this is just like eating your vegetables and, doing your exercise. It should just be a part of life, but it's not really, is it? Like these are not things that we value. And, if you have your family and your job, like you can't just tell your boss, hey, I got to go like meditate for 15 minutes. I'll be back. Like that's not, it's just not something that we value enough in our society.
It is to schedule this, actually. It's like to put it in your calendar, be like, okay, well, first of all, put in the calendar, you got to take lunch. Put it in the calendar that, that you need to exercise, that you need to, and if it's not journaling, if it's like walking with intention, like meditative walking or just being out in nature, something that, something that feels right for you or some deep breathing to be able to add that in because the schedule will get packed up. I was talking to one of my friends there. He literally has 75 meetings a week. I'm like, I don't even know how you're even breathing. Like, when are you having your lunch or going out? And he's just started adding in like going to the gym. And turns out he has time to go to the gym when you start to put these things into our life. Because otherwise it gets taken up. And then sometimes it'll get taken up with maybe some Netflix or some other stuff, right? And so how do we do things that are going to serve us? And that whole positive psychology of looking for the good. Turns out for the good, we find more of the good and all those synchronicities and all these things start to show up. We look for the crap, we're going to find a lot of it. So, right.
But I think what you're saying is just so important because I think especially for women, we feel like our role is to do for others, right? So we're constantly looking after our families and our parents and our pets and our yards and our, whatever. We put ourselves last, but that's not how your body needs to be for fertility. And goodness knows that's not any good for libido.
No, exactly. So, okay. So the stress piece, what about any supplement? People are like, what's the supplement? But what are some supplements? I guess the desire piece, we want to obviously nourish those adrenals. Sometimes we might need a little additional help with the adrenal piece. That's why testing and things like that come into play. But what do you see in there?
Okay, so for people who are kind of stressed and wired, and we kind of, whether we know from their test or we presume that their, sympathetic nervous system, their fight or flight response is kind of always on, and we want to be more calming. There are certain herbs and things that we can use. One thing is called phosphatidylserine that can be calming if your cortisol is too high. There are certain herbs like melissa and magnolia and lavender. There are certain things that are calming. If you are like exhausted and just kind of wiping the floor and have no energy, there are certain herbs that can be more energizing, things like ginseng, for example. And a lot of times these herbs that help with our adrenal function, they come in blends. They're called adaptogenic herbs. And so a lot of times there's a mixture of some of these different things. And ashwagandha is a really great one, can actually be helpful if you're kind of high or if you're kind of low. And it's good for thyroid function too. So that's good. Another hormonally related supplement that can be helpful for some women is DHEA. It is sold over the counter in the United States. I think it's important to know what your DHEA level is, because if your DHEA level is already kind of high, adding more isn't really going to do the job. But If your DHEA level is kind of low, either because of stress, because of age, or whatever, taking DHEA as a supplement can help you to make more testosterone, and that can help with libido. So that's one. Another thing I would say too is just sort of general overall good health is important for libido. So, omega-3 fatty acids, making sure that you have enough vitamin D and taking a supplement if your vitamin D level is, at the bottom of the range. Maybe even just a good quality multivitamin. Just overall good health is really important if we're trying to boost libido.
Yeah, that DHEA can be a standard of care. It can be like a standard of care recommendation for diminished ovarian reserve. And sometimes, yeah, no one will test the levels, like you're saying, and maybe some side effects can be greasy hair and greasy skin. And I've experienced where I took it and I was like, what is that smell? And it was my scalp. I was like, what? I was like washing it. I'm going, what is going on? And I heard someone saying that after a week. They're like, yeah. And I kept telling the hairdresser, I'm like, I can't get my freaking scalp clean. And I realized the correlation of the DHEA, and I'm like, that thing did not work for me. So sometimes people are taking it, they haven't tested, and it's just not the right move.
And one of the most common causes of fertility issues in women is PCOS, right? Polycystic ovarian syndrome. And so some women with PCOS just naturally make too much DHEA. That's kind of part of the underlying problem in the first place. So that's an example of where taking more isn't going to be beneficial. So it's better to know your level. And if your level is in the bottom end of the normal range, then maybe it would be helpful. If you're already kind of at the top, it's probably not for you.
And then now, okay, so let's talk about, so you got erectile dysfunction and painful sex. Let's talk about the painful sex. So like a structural thing where you're like, oh my goodness, I don't even want to go there. So what are some things we can do to help with that?
Okay. So now we're not talking about a brain thing anymore, right? We're talking about a pelvic thing. Something's wrong and it hurts. One of the first things that probably would be worth doing is going to see a pelvic floor physical therapist, because you can have tight muscles, you can have ligaments that aren't doing the right thing, you can have all kinds of things going on that cause pain, especially when you're relatively younger. Like when you get older into menopause, it can be from hormone loss and vaginal dryness and things like that. But when you're younger, when it's painful, if you think about your pelvic floor, it's, I don't know, it's like a basket of woven muscles and ligaments and things like that. And if things aren't working properly, you can have all kinds of pain. And a pelvic floor physical therapist can help you understand why you're having the pain. And oftentimes they can do things in order to fix the pain. So that's sort of a good first place to start. You can just also start with your gynecologist. They can do an internal exam. Maybe you have fibroids or, something in there that's not really supposed to be in there that's causing problems. So you want to rule all of those things out.
Yeah, endo, yeah.
Yeah. Endometriosis, exactly. But then if all of those things have been ruled out, we still do have some things that can be helpful. If you are sort of maybe, into your 40s and your hormones are shifting a little bit, you can start to have vaginal dryness. And the younger you are, the more likely it's going to be because of low testosterone and not because of low estrogen. Estrogen keeps your tissues hydrated so that they don't become dry and, thin and easily torn. But testosterone keeps things lubricated. So just like too much testosterone can cause you to have oily hair, it causes you to have a more, lubricated vagina. And so if your testosterone is going down, because testosterone can go down way before you hit menopause. So if your testosterone is low, you can have vaginal dryness, and that can make things uncomfortable. And so again, being evaluated, understanding doesn't always mean you need testosterone replacement therapy, but looking for the cause of the low testosterone so that we can do the things that we could do to naturally make it go up can be really, really helpful. Sometimes there can be emotional trauma, whatever you may have been in the past can cause you to kind of be clenched, and, it's just a trauma response. It's not a conscious reaction. And so dealing with that can sometimes be really helpful. But we also have newer technologies that can make a really big difference for people. So one of the things that we can use is called platelet-rich plasma. And platelet-rich plasma is where we draw your blood, just like you're getting a blood test, and we separate out the growth factors from your own blood. They're found mostly in the part of the blood with your platelets, which platelets are involved in blood clotting, but that's not what we're thinking about here. But the growth factors are involved with the platelets. So we separate the growth factors out of your blood, and then we can inject them, just little teeny weeny injections. It sounds kind of harsh, I suppose, but it's really not a big deal procedure. But we can put little injections of your own growth factors into the vaginal area, which just helps rejuvenate things. So it helps grow more nerve endings and build more collagen fibers and resuscitates the cells in the area. So it can help improve lubrication, but it also can be really, really helpful for women who have painful sex. Sometimes it can be like just totally transformative. Most of the time, it just takes one treatment. Sometimes, if it's a bigger problem, we do 2 or maybe even 3 treatments. But it's a really nice treatment because it's harnessing your body's own natural ability to heal. We're not putting foreign things in. We're just rerouting your own natural growth factors into the area that we want them. We also have some lasers where we can do vaginal laser rejuvenation. And that also can be helpful for the lubrication, for toning the area, and can also help with painful sex. And both of these treatments can be really helpful for stress incontinence too. So if you're leaking a little bit of urine when you cough or sneeze, these can make a really big difference. A third thing that we have that we can do here is we can use sound waves. Excuse me. So there's a chair that you can sit on called Emsella, and that sends energy waves into your pelvic floor. Or we can use acoustic wave therapy. We have kind of, I don't know, it looks like a microphone, I suppose, or like a little gun that we put on the outer part of the vagina, and the sound waves go in, and they can rejuvenate the area. Excuse me. So we have all of these different treatments that can make a really big difference.
Yeah, my friend's doing the chair where she had the incontinence piece, and then she's got to do like 5 or 6 sessions of sitting on the chair, and it's, I guess it's like Kegels on steroids, but you're not really doing the Kegels. You're just sitting there, and she's like already, because before she would, she's in menopause, but she, before she would sneeze and be like pee her pants, or she's jumping on a trampoline going, oh my goodness. And so she's like, I got to do something about this. So obviously that's people that are, experiencing that. But, and so just back to the PRP. So obviously many times people like here on the fertility journey, we're doing PRP, ovarian rejuvenation. Some people have probably heard about that. Obviously for diminished ovarian reserve, you can, doing that, putting the ovaries. Now for this, in the vagina, what are they? I'm assuming they're numbing that, because that sounds damn big. We're like, so what does that look like? That sounds scary.
Yeah, we can put some numbing cream, but the inside wall of the vagina doesn't really have a lot of pain fibers. So it's just a little needle prick. It's not very uncomfortable. You might feel a little bit of pressure. Sometimes you feel like you have to pee afterwards. But it's really not bad at all. You know what? I probably need to go get a drink of water because I'm
Go. Yeah. I was trying to talk there to keep you going, but yeah, go ahead.
I'm dying here right now. Okay, I'm so sorry. I think I'm resuscitated. I hope.
Okay. I know I had that too, where every time I started coughing, I'm like, I started talking, I had a cough. I'm like, what's happening? Okay, yeah. So we do that, so it's not as painful. The laser thing too, because I've had my underarms lasered. I'm like, woo, that was fun. It wasn't fun. So how would that be for the vagina? That's not painful then? The laser flying away in there?
Same thing is inside the vagina. There's not a lot of pain fibers, even though we're talking about painful sex here. It's more like a stretching pain and things like that. So it's really not uncomfortable. We also can treat the external area. So like sometimes women find that their labia kind of gets stretched, or, they're just wanting to kind of tighten things back up again. And so when we do the laser on the outside part, it feels kind of like a hot stone massage, but it's not painful.
Okay. Sounds, yeah, I like a hot stone massage. That's good. Okay. And then what about like that vaginal estrogen and things like that? Like what for painful, like what are you seeing there?
So for women who are kind of getting into the perimenopausal time in their life, our ovaries become unreliable. So sometimes we make estrogen, sometimes we don't. We're kind of all over the map. And for those women, we can use a little bit of vaginal estrogen in order to kind of plump up the tissues, lubricate things better. But um, low estrogen needs to be the problem. So what I see a lot is gynecologists feel pretty comfortable handing out estrogen cream. But if the problem is testosterone, then the estrogen cream isn't going to fix the problem.
Yeah, it's like to have these things alongside. Sometimes you need the thyroid medication. Maybe you need the vaginal, the vaginal estrogen, but we need to be working on the reason why all this stuff is imbalanced to begin with. Like if your cycle is irregular and like we said about the adrenal piece, we just did a long talk about, well, not a long talk, but talking about the stress piece, which is key, right? And we can't outrun this and just take a pill and think it's going to be okay, right? So it is in a targeted manner, looking at testing and like developing a plan for this and then using some supplements. And yeah.
Yeah. And I think it's important to say that for the majority of people, it's not that there's one problem. Like they have a lot of stress that affects their, cortisol levels. Cortisol gets in the way of their thyroid functioning properly. So now their thyroid goes down. The cortisol gets in the way of their ovarian function. So now they're not making enough progesterone. So now they're not sleeping well. And if you're tired, of course, your libido is going to go down. And then, if you aren't eating well, or like we have all these little things going on that all add up. So there's no like one pill that's going to solve the problem, or if you just take one supplement it's going to fix the problem. We really want to kind of address all of the different things that are going on. And I would say if we had to start somewhere, the somewhere is taking care of yourself, nourishing your body, getting some physical activity, managing your stress in a healthy way, getting enough sleep. Like that's just non-negotiable. That's the place to start.
Absolutely. And that's libido is just a symptom of all the other dysfunction going on in your body. And so good news, there's things you can do about it. You don't need to, prop it up with medication. Sometimes you can, but we need to, dig for the root cause. Okay. So let's talk about if we're dealing with erectile dysfunction with the ED, which is very common. Guys are suffering when not really talking about this. So obviously Viagra is what flew off the shelves. So obviously there was a problem, but what are we seeing there for things to help with ED?
So the vast majority of men who have problems with erectile dysfunction is a blood flow issue. And interestingly, if I could just make one little comment before we go on to the men, is kind of the same thing for women. We need blood flow to that area in order to become aroused. And so anything that gets in the way of blood flow is going to cause a problem. So for men who have the beginnings of heart disease, that means plaque is, blocking up their arteries. And long before they have a heart attack, we can start to see it in erectile function because those are much tinier. The blood vessels that are taking blood into the penis are much tinier than the big blood vessels around the heart. So if the blood vessels are starting to get gunked up with plaque, blood does not flow as well into the penis. And erections, can still be there. They're just not as strong as they used to be. And if you don't have a strong erection, that all that blood flow in there squeezes the veins shut. So if they're not being squeezed shut all the way, then there's backflow, and then the blood starts to kind of just leak out and they can't maintain an erection. So this is really a blood flow issue. The reason that Viagra works is because it opens up blood flow. And it doesn't just open up blood flow to the penis, it opens up blood flow all sorts of places. And so a lot of men will find that they have things like headaches or backaches or other things because there's blood flowing in places that it's causing other kinds of problems. But nitric oxide is something that's really important for both men and women to open up blood vessels. So we want good blood flow to our brain so we can think straight, and good blood flow to our heart so we can be healthy. But also we need enough blood flow to get to our genitals. And so nitric oxide is found in beets. So eating beets is one way to go, but you can get different kinds of supplements that boost nitric oxide levels, and that can be good for sexual function for women, and it can help with erectile function for men. Another thing that we can do for men is we can do this acoustic wave therapy. So we call it Gaines wave. But what happens is we have this, I don't know, it looks like a gun, and we just treat along the shaft of the penis, and it shoots sound waves into the penis, which break up the little micro plaque to clear it out. Also pulls more stem cells into the area. Stem cells are the cells of repair and rejuvenation so that it can start building better blood vessels and getting better blood flow. And it works really nicely. So men Sometimes they get to a place where even with the pills, they're still not able to have very good erections. And if we add the acoustic wave therapy, then we can make it so that now the pills work better, and they can. Or if the pills work perfectly fine, we can do these treatments and we can make it so that they can have an erection without even needing the pills anymore. So it works really nicely, but it's something that's done in the office. There has to be a series of treatments, 6 to 12, or sometimes even more, depending on how bad the problem is. And it works best when we start earlier. So instead of waiting until you can't have an erection at all, we want to start when the problem is more mild, because we're going to have much better results, and we'll be able to preserve function, going on. Because it's the kind of thing that just gets worse over time. It's not going to magically get better if you do nothing about it. And one more treatment that works really nicely for men is going back to the PRP. So we can do PRP injections into the penis, and the growth factors create more blood vessels and nerve endings and collagen fibers and just make things work better. And again, we put numbing cream on. It's the teeniest little needle you ever saw. It's
Guys are like, no.
way worse than what it is. It's usually a one-time thing. Sometimes you come back and have a second one, but it really works and it makes a difference. And so sometimes, this is something that's really upsetting to men. This is something that they really want help with, but it can be really difficult to go in and say something to your doctor. All your doctor's really got for you is, the pill, the Viagra or whatever, brand of pill it's going to be. But there are all these other really great modalities out there that are kind of more healing, right? Like they're regenerative. They're fixing the underlying problem so that you don't need to keep taking the pill. But sometimes men need a little bit of encouragement from their significant other to go in and find the right kind of doctor who can help them and get the right kind of help, because, it can be pretty intimidating to go in and admit you have this kind of a problem.
Absolutely. It's common though, right? So obviously with heart disease on the rise. And what about, sorry, go ahead.
It's amazing how it's for young men. Like we, used to talk about low testosterone and erectile dysfunction as being, what happens when you get old. So like if you're 70 years old and you've got these issues, we would sort of say, okay, well, it's your age. But we see this all the time in men in their 20s and their 30s. It's become really common, and partly the toxins in our environment, our stressful lifestyle, we know all the things that go into it. But if you're having erectile problems, that sort of means that whole system isn't working well. And there's probably more to fertility issues than just being able to, have penetrative sex. So it's an important thing to look into.
And then the waves, what's the comfort level on that for people when they do the wave therapy for the guys?
It's not uncomfortable at all. We don't need to use numbing cream or anything.
Okay. And then obviously if you've got issues with this, like looking at your cholesterol and all that kind of stuff. So making sure, looking at your biomarkers and looking at your overall health, which then is going to improve your semen numbers, if depending on what we're finding on there. So to help with, I think that these are good modalities to be able to help. Like right now we're trying to have a baby. And so if you can get the ED taken care of, and, with a PRP, with the wave therapy, and then in conjunction working on the rest of your health, so then you can get that in good working order. We work with a lot of people that are on like a second, maybe they've found a person later on in life, their partner, maybe he already has children, maybe he's a little bit older. And so there's that. Or also, like you're saying, you're seeing this in like 20s and 30s and 40s, like young men. So it is about working on your health and then doing those other therapies alongside.
And I think if we could just sort of say too, for men, right, for women, we talked about how there's the desire issue, which is a brain thing. And then there's the responsiveness issue, which can be from the blood flow or, hormone deficiencies and things like that. So for men, it's the same thing. So for guys who the desire is there, they just can't perform. That's when, these kinds of treatments would be important. If the desire is not there, that's a brain thing. So these kinds of treatments on the penis aren't going to fix necessarily the desire thing. So to some extent, if a guy feels really good about himself and, really good about his ability to perform, that can certainly help with desire. But here again, we need to think about his medications, just like for women. We need to think about stress. We need to think about depression. And we need to think about testosterone. And the challenge that we have is if a guy does have low testosterone and we just give him testosterone replacement therapy, we shut down fertility. but we can use things like HCG and clomiphene, different things that can boost testosterone and boost fertility at the same time. So it's just really important that guys aren't headed off to like the low T clinics or the ED clinics and just getting automatically put on some kind of testosterone replacement therapy without some kind of an evaluation to understand what's wrong. Especially if they're younger, why are they low? And then also some kind of a conversation about how this is going to affect fertility and what the choices are. Because we don't want you to have low T, but we don't want to shut down sperm count either.
Right. Sometimes I've found people aren't having those conversations. They have no idea that the testosterone therapy is really impairing their fertility, and they're just thinking, "Hey, I feel great. I'm trying to work, improve my testosterone, and here we are. We're trying to have our baby. We're wondering why it's not working." But yeah, so that's that having a doctor that's understanding what's happening here with your health when you're on the fertility journey. Okay, so actually, you've got a busy women's guide to symptoms of hormone imbalance, and the listeners can get that at isityourhormones.com. So what can they expect there?
Yeah, well, so the most common thing that I hear when people come in to see me is, I don't feel good, like this doesn't feel normal, but I don't know, do you think it could be my hormones? So I wrote a book to help women understand. It's got a lot of checklists, so you can, go through the symptoms and see, like, do I have symptoms of low testosterone or low progesterone or whatever? It's got some ideas for like natural things that you can start to do to get your hormones back in balance. And it's also got suggestions for how you can talk to your practitioner so that because if you're trying to work with your family doctor, your gynecologist, they don't speak the same language. This isn't really something they're familiar with. It can be really difficult. But it's also got some resources on how you can find functional medicine practitioners, because you need somebody that's going to really evaluate what's going on.
Awesome. So we'll have that in the show notes. So isityourhormones.com. And any final thoughts for us today, Dr. Deb?
Yeah, I guess my main thing that I would love to say is that we really all need to take control of our own health. Your doctor doesn't have a pill to fix you. That's not what we were trained to do in medical school. We were taught to treat diseases with drugs. The good news is there's so much that we can be doing to take control of our own health. And I believe that always living well is the best medicine.
I love it. Awesome. Thank you so much.